Welcome, everybody. This is our first session of our Navigating ALS series, and this is geared for those who are fairly newly diagnosed. The hope is to give you guys a kind of a foundation of knowledge that will help you move forward in this journey and give you more confidence, give you more familiarity with the journey. And so today we'll have several speakers, but they'll be introduced in a little bit. Just a reminder before we get started, this presentation will be recorded and we will email this recording out to you guys in the next couple of days if you want to reference it later. There's a lot of content in here and some definitions and things like that, so it may be good to have as a reference piece. The best way to view this presentation is in speaker view. And I believe on laptops and tablets, it's at the top right. You can change the view from the grid view to the speaker view, so you can see both the presentation and the speaker. So we will keep everybody on mute. So if you don't mind making sure that everybody's on mute so we don't have any background noise, but yeah, so thank you again for joining us today. With that said, I want to pass it over to Linda Quiros.
Hello, everybody. I would like to give you a brief overview of what the ALS Association does and how we can help you with your journey. The association is striving to create a world without ALS. Everything we do can be traced back to this vision and no longer hearing of people being diagnosed with ALS. We want to discover treatment and a cure for ALS and to serve, advocate, and empower people affected by ALS to live their lives to the fullest. Next slide. The roles of Steve, Jennifer, who you'll meet next, Jordan, and myself are to help you meet a variety of needs, both tangible and emotional. We want to give you information, but we also want to give you hope. We want to inform you of your options and help you get connected to resources that may benefit you in your journey. We want to empower you so you're able to make informed decisions. We want to give you information on managing the disease and general overview of the progression, because we have found that no two people are the same and the progression of ALS can be unpredictable at times. I'm now going to hand it off to my teammate, Jennifer Beckett, who has worked towards these goals with the ALS Association for over 9 years, covering patients' needs in Central and West Texas, Austin, and El Paso. Please welcome Jennifer Beckett.
I'm doing a webinar. Do you need me?
Hi, everybody. Thank you for joining us today. Like Linda said, I'm going to go over a glossary of terms. When you go to a multidisciplinary clinic, you all of a sudden hear a lot of initials thrown at you. In the medical field, which you're probably all pretty aware of, it is all about MDs and ODs and all kinds of different stuff. So we just wanted to clarify this for you. When you go to a multidisciplinary clinic, if you have it, this will help you be a little bit more prepared for what people are talking about. So we'll just briefly go through a list and kind of touch on what they do. So ALS, amyotrophic lateral sclerosis. MND is motor neuron disease. And typically ALS is referred to as MND across the pond or in Europe. ELA, sclerosis lateral amyotrophica, ALS in Spanish. I think that's the first time I actually tried that. Physical therapist is PT, and the physical therapist is going to come when they meet you, and they're going to meet you, check your muscle strength, see where you are, help you to continue with the right exercises and to do things safely, and to keep your muscle function and stuff as strong as you can. Occupational therapy will come and help you just to continue to be independent and to offer you suggestions, different equipment and different things like that, just to help you keep on keeping on. Respiratory therapist is the one who'll assess your breathing. There'll be different, we'll go through some other little acronyms later, but there's different tests that they'll do each time you go to the clinic to test your breathing function. Speech language pathologist is SLP. Not only do they look at speech, they also look at swallow, and a lot of times they work together with the dietitian to make sure that you're getting the right nutrition. PBA is pseudobulbar affect. Pseudobulbar affect is something where you cry or you laugh, sometimes uncontrollably and sometimes inappropriately. They like to assess people for that because there is a medication that can help you with that. CNS-LS is the Center for Neurologic Study, a lability scale. Next slide. And then the ALS-FRS, Amyotrophic Lateral Sclerosis Functional Rating Scale. So every time you go to the clinic, there's a list of questions. Sometimes you answer them and sometimes they answer them for you based on their time with you. And it gives you a number, and that number is kind of where you are with things. And by looking at that scale, we can better target how to help you, how to target and how to help you the best in your journey. The Eat 10 is it's an eating assessment tool. There's 10 different questions and it helps us guide proper nutrition, types of foods you should and shouldn't eat. And PFTs is your pulmonary function test. And that's what I refer to with the respiratory therapist. So when they come and they meet you, if you go in every 3 months, they're going to do a series of 2 different tests. One is called, and each one will get you a number, and these numbers will say, yeah, it's time that maybe we can look at some different types of equipment that can help you, or yeah, no, maybe we're not going to do that quite yet. It's just a tool just to help make sure that we're guiding you in the right direction. So forced vital capacity is when you take a deep breath and you blow, and the therapist will tell you blow, 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 and that'll give them a number. Maximum inspiratory pressure is they'll say kind of similar, blow out all the air and then breathe in. So what they want to assess is how well you breathe out and how well you breathe in. ADLs is activities of daily living, which is bathing, dressing, and toileting. A lot of times this is where the occupational therapist will come in and they'll say, okay, how are you doing with these things? And offer you suggestions, equipment, safety, different education and information. DME, durable medical equipment. And that covers a wide range of things. I always say a lot of these things that, like soup to nuts, from a cane to a, power wheelchair. And there's a lot of different things in between. People don't know the things that are out there to help them, because why would you? You don't know what you don't know. So a lot of times you'll have a volunteer, like an assistive technology professional volunteer, who can help assess what you may need and to help guide you through that journey as well. Range of motion is this. PT will help you with different exercises. Range of motion is good for all of us. Keeping our muscles and keeping everything fluid is important for everybody. And so that PT will help you with that. Okay, bulbar. So there's, so facial and the neck region involving muscles for swallowing and speaking. So bulbar, sometimes when somebody says I have a bulbar presentation, it's when people will have an ability to speak or articulate properly, and that's where that comes from. Motor neurons, nerve cells in the brain and in the spine, and they send the message to the muscles to make them function. Fasciculations is like twitching of the muscles. Sometimes we all have, sometimes you have benign twitching, but it's twitching of the muscles, and a lot of times you can see. Atrophy is a loss of muscle mass leading to muscle weakness. A lot of sometimes there's key places where people notice, and sometimes it's in the hand. There's different muscles here, and then you can notice that they're maybe not as strong or as prominent as they used to be, and that's called atrophy. Dysarthria is impaired speech and language, and sometimes I wonder why they have to come up with these fancy names instead of just saying we have impaired speech and language. So. And then dysphagia is difficulty in swallowing, and we have siluria is excess salivation. Not everybody gets that with ALS, but some do. So if it happens, don't be surprised. There's different medications that you can use to help with that. What else we got? Okay, I guess that's it. So we discussed briefly the role of the role we play in your journey, and we have walked through some of the acronyms and definitions. As mentioned before, we're here to meet the tangible needs, but also acknowledge the emotional impact of the diagnosis. We hear from pals and family that the emotional battle is at times more impactful than the physical battle with ALS. Here with us today is Velma Metz to talk through some of the emotional impact of the diagnosis. Velma is a psychotherapist and has worked with a number of families as a member of the ALS clinic team at the Emory-Billard Clinic at Baylor Scott & White in Round Rock. Velma, take it away.
All right. Thanks so much for letting me join you guys. I've been a part of this team for a little over a year, and I would say I really love getting to meet the patients and the families and getting to talk to them and hearing their stories. Like we said before, ALS is different for every person. And so definitely hearing the stories, everyone's a little different. And I love getting to just get information on how people handle it, because everyone handles it a little bit differently. So that's part of my job on the team, is just to help patients and their families figure out how to cope with the emotional side of the disease. But I always find it's more helpful to hear it directly from somebody and not just from us professionals. So today we are going to talk to Sarah. Sarah was diagnosed with ALS in October of 2020. And she was recently married, and this is her beautiful picture. I think we were all commenting on how much we love it and seeing how happy she is in her beautiful dress. So I'm going to bring Sarah on so we can talk together and get a little bit more of her story. Hey, Sarah.
Hello.
Hello. All right. So we're going to ask you some questions. My first one is, can you walk us through kind of what the experience was of receiving your diagnosis? And if you can describe what your reactions were when you first got the news.
Yes, I was a massage therapist and I was having trouble straightening my finger, and I thought that it was due to working too much. And I went to a rheumatologist and got diagnosed with rheumatoid arthritis. And then I kept getting worse and worse. And finally, my physical therapist directed me towards a neurologist, where I had a very painful EMG. And then I was diagnosed for the first time and given 14 months to live. After that, I went and had 2 other opinions from Dr. Hussein and Dr. Pell in Houston, and was given the same diagnosis, but with much more time, to live. That was a really hard pill to swallow at first, like hearing the doctor say you only have 14 months to live. And I know that some doctors just throw out numbers and they don't really know only God knows what's gonna happen.
Yeah. What was some of your emotions, or because you said it was pretty shocking to hear that number, but what were some of the other emotions that you kind of ran through as you got that diagnosis?
Anxiety. Very, very high anxiety. And I feel like with the disease, I'm always kind of battling having anxiety and being in the present instead of worrying about what tomorrow holds or the future. Really, today is the only day that we all have, and focusing on that is the way to go.
Yeah, absolutely. What approach, or kind of how did you tell your friends and family about your diagnosis?
I told my friends, and I just was educating people. A lot of people haven't heard of ALS, or they've only heard of Lou Gehrig's and are just not familiar with it. So I was having to educate a lot. And then my father is 89, and suffering from dementia. And so I have not like straight out told him what I'm going through. I see him often and he knows that I'm physically struggling, but I don't feel like they should like have that burden of, Googling. And whenever you Google this disease, it's just so negative and causes so much fear in everybody's lives.
No, absolutely. Yeah. And how do you think you compare now, when you talk a lot about anxiety, like from when you were first diagnosed, to how do you feel like your emotions are now compared to that first diagnosis day?
I still feel like I suffer from anxiety. I definitely worry a lot about what the future holds, and just like certain things that doctors say stick in, like, my heart and my head. And sometimes those are hard things to let go of. But like I said, I pray a lot and, find the support of my husband and my friends. And I take CBD to help with anxiety too. But just, reminding myself to always be in the present and be enjoying what the day is bringing me.
Absolutely. And I would say, like, anxiety is so normal. Like, so many people, like, in general, talk about it, especially in a diagnosis where things can change. And with each doctor visit, like you said, depending on what they say, can create new levels of anxiety, I would imagine. And I love your tactics, because kind of was like my last question was, how do you guys cope with this? I would say, how does your husband help you? Because you said he can kind of be helpful. How does he help you out?
He stays really positive all the time. He is my rock. He is just always encouraging me to like listen to positive podcasts. We are kind of taking a holistic approach to everything. And I'm working on like finding underlying causes of ALS. Which is a lot of like detoxing my body, getting my gut healthy, changing my diet to anti-inflammatory foods. And then like I've had my cavitations in my mouth cleaned out with Dr. Nunnally. And I just feel like doing proactive things are really what's keeping me positive, because when somebody tells you there's nothing you can do but go home and pretty much, wait to progress worse, I don't think anybody wants to live like that. And there are a lot of things out there you can do to be proactive.
Yeah, exactly. And it sounds like too, like you're finding ways to take it one day at a time and finding ways to find joy in life every day. And kind of wrapping up, can you think of any like words of wisdom or things you would want new patients to hear from you? I mean, because it's now been a year and a half, and kind of curious to hear what you have to say. Like, if you could pass something on, what would you want to pass on?
I think the whole being proactive thing has really helped me. I'm still walking, but I did fall down and break a rib when trying to avoid using a walker. And I just feel like, kind of getting tools and learning how to use them isn't weakness, or it isn't like you're committed to it. I recently got a portable wheelchair from Team Gleason, and I love it. It allows me to go walk my dogs around Town Lake, but that's like the only time I use it. Other times I'm using my walker and still walking. So I just think it's kind of good to, you know, take steps to like learning how to use equipment that might help you in the future. Or if you're not able to go do things that you used to be able to do, like me walking my dogs, that wheelchair has allowed me to get back and do things that I love doing.
Absolutely. I think that's one thing I hear a lot from patients is finding maybe more creative ways to continue the things they love, right? And using those tools to make it happen. So yeah, absolutely. Well, Sarah, thank you so much for being honest and kind of transparent about how you're doing and your diagnosis. I think we're going to hand this back over to Jennifer to go over some chapter resources.
Thanks.
Here you go. I'm back. Okay. Well, thank you guys. Thank you, Velma, and thank you, Sarah, for sharing. I mean, it's hard, but I appreciate you sharing a piece of yourself, you know, to help other people. I've known Sarah since she was diagnosed, and I think the thing that sits on me the most is her smile. Like you see that smile, and it's just that attitude of keeping on. You know, you just got to keep on keeping on. And so yeah, I was really glad you were able to share that, and thank you. Let's see. So other happenings here going on with the association. We've got monthly connection groups. We've got family talks. We've got Stress Less on Purpose running on empty. We've got some groups for youth. We've got some veteran groups. So we encourage you to go to alstexas.org and go down and see what other groups are available. Sometimes you can go to past events and look at other things that we've already done, and you can look and see what is going ahead to the future. There's something for everybody. So take your time to, peruse that and see what else we can, however we can help you. We're here to help you. Slide. Here's us. And so Steve, me, Linda, Jordan, and then we have Tanya and Marshall have all two roles to play in your support. Marshall's our equipment guy. Tanya is the one who does a lot of our programs and a lot of those things that are on alstexas.org. And Linda, Jordan, Stephen, and I are here just to help you with your journey. Anything that we can do, any way that we can assist, please don't hesitate to reach out to us, and we can help you however we can. All right, well, thank you for attending. Our next session is going to be February 8th, and that's going to be ALS research. Remember, if you've registered for this, it'll be recorded and it'll be sent to you. That's about it, eh?
I'm just wondering if anybody has any questions.
Oh,
We'll give it a few minutes, and you can do that in the chat box, maybe for Sarah or Velma or one of us.
You're welcome. I don't think we do. All right. Susan just says thank you for the information. So you're very welcome. And like I said, we're always here to help however we can. There's our contact information. And if there is no questions, I think we'll wrap it up. Thank you for joining.